Okay, antidiuretic hormone. First, let's take a look at the nomenclature for this hormone. So it is going to be considered antidiuretic. So a diuretic is normally a substance that will make you excrete more urine. So alcohol and caffeine are examples of diuretics. Antidiuretic hormone is going to have the opposite effect. So what's going to be the stimulus for the release of this antidiuretic hormone? So one will be the presence of angiotensin II. That's going to be released in response to low blood pressure. Another will be a decrease in blood volume as well as an increase in blood osmolarity. So where is this antidiuretic hormone going to be released? It's going to be released at one of the major endocrine glands of the body, which is the pituitary gland. So here we have the anterior pituitary, the posterior pituitary. Superior to that is the hypothalamus. And it's going to be the posterior pituitary that will release this antidiuretic hormone. There are two hormones that are released from the posterior pituitary. One is antidiuretic hormone, the other is oxytocin. But in this scenario, we're going to have the release of antidiuretic hormone into the bloodstream. And so here, because the hypothalamus is also perfused with its own blood supply, antidiuretic hormone is going to feed back onto it and activate the thirst center within the hypothalamus. That's going to lead to an increase in water intake, an increase in blood volume, as well as an increase in blood pressure. At the kidneys, this antidiuretic hormone is going to result in the upregulation of protein channels called aquaporins that will be involved in maintaining or reabsorbing water into the bloodstream. That will lead to an increase in blood water volume, an increase in blood pressure, and a decrease in blood osmolarity. So the blood is going to become more dilute. At the systemic blood vessels, we're going to get vasoconstriction. So the diameter of those blood vessels is going to decrease. And in so doing, that's going to increase peripheral vascular resistance and also increase blood pressure. So with the release of this antidiuretic hormone, we've elevated the amount of water within the blood and also increased blood pressure, bringing it back into homeostatic range.